Hi, my name is Becky Captain. I'm the nurse practitioner in the Preventive Cardiology Clinic here at the Plaza. This is my patient, Mr. Reyes, who came to me in May of 2003. I'd like to talk with Mr. Reyes about what brought him to the Preventive Clinic and how he feels since he's come to the clinic and has had the opportunity to make risk factor modifications. Mr. Reyes, what brought you to the Preventive Clinic when you first came in May of 2003?
My primary doctor suggested that I needed to have better consultation with an aggressive plan to control my lipid profile. I had noticed one day, and my doctor told me that I had a very milky blood as soon as the blood was drawn, and that pretty much gave me an alert that I better see about it.
What were your cholesterol numbers and your blood pressure when I first had the opportunity to see you in the Preventive Cardiology Clinic?
In May of 2003, my total cholesterol was 1,216. The good cholesterol was 12. That's the HDL. My triglycerides were well over 11,000, and the LDL would not even register. My blood pressure was 138/88.
What did we do together to get your risk factors under control?
The statin medications were added to my regimen of drugs. High doses of omega-3 fish oils, changes to my blood pressure medication, and lifestyle changes, which included exercise and what I was eating.
Great. And some of the medications that we changed were beginning a statin and adding omega-3 fish oils to help with your triglycerides. And then we changed and increased some blood pressure medicines. But your lifestyle changes were consisting of what?
Exercise, a minimum of walking, 10,000 steps, approximately equal 5 miles. I do some aerobics. It's 3 times a week for 30 minutes at least. And my eating habits and preparation of the foods were also changed.
And what was your cholesterol and blood pressure values in October of 2003, 5 months later after you came to the clinic?
Well, I'm happy to say my total cholesterol at that point was 144. My HDL was 59. I did have a positive reading of LDL of 54 with triglyceride levels at 160. My blood pressure was 102/64.
That was quite the feat, wasn't it?
Yes, it was. It was so impressive. I just couldn't believe it myself.
So it can be done. We can get with lifestyle modifications and medications and over-the-counter supplements, we can get your risk factors to optimum levels.
That is correct. I'm a true believer in what all has happened, and I intend to stay on this program for the better part of my life.
How do you feel since you've got your targeted numbers and values?
Well, I feel much more energetic, and I feel like I used to feel when I was younger. I have a better stamina and overall good feeling about myself.
Mr. Reyes, you've done an excellent job completing your medication regimen and completing lifestyle changes to reduce your risk for having cardiovascular events in the future. Additionally, when you came to us in May, we assessed your non-traditional risk factors for heart disease. That included homocysteine, Lp(a), fibrinogen, and your C-reactive protein. And in October of 2003, all your non-traditional risk factor values were within normal limits. What an excellent job you have done to reduce cardiovascular events and to optimize your health and to increase your longevity.
Thank you very much. I'm very glad to have participated in the consultant's advice, and I will continue to do so to elongate my life.
Thank you.